What happens, I ask, when people that are trained to save lives are barely just trying to survive, hanging on to life? They are not just bleeding, they are breaking. Yes, we're talking about the medical doctors in Nigeria. In Nigeria today, the doctors are getting tired and more tired by the day. They are breaking. Long work hours, excessive long work hours, poor pay, no equipment or dilapidated obsolete equipment, and the systems seem to be pushing them out. So the real question is, for how long can they hang on? For how long can this go on? I will play for you now a short video made by a young medical Nigerian doctor crying on the Twitter, that is X, lamenting about the state of health in Nigeria and the condition of the medical doctors. You will listen to it, then I continue after that. I went to his page to check it out, and I observe or discover that for the past 2 years he has been an advocate, crying and calling on all the agencies and all the authorities in charge of the medical practice in Nigeria, of the health sector, from the minister and the Ministry of Health to policy makers, to do something about this. A stressed out doctor, what can he do in the theater? What can he do in the process of consulting when himself, his brain, his system is fogged out? Listen, and I'll meet you after that.
For 10 years in medical school, they have told us that we are going to be the future of medicine in Nigeria. But was that future meant to be this dark? Today I watched a 3-year-old's life slip away just because his mother couldn't afford 5,000 naira deposit for oxygen. 5,000 naira. That is the price of a life in Nigeria. I watched him with consultants' knowledge in my head and a beggar's resources in my hands, and malaria doing the job of a firing squad. Poof, poof, gone. I'm just one man doing the job of 10. My heart doesn't beat anymore. It just thuds, trying to keep up with the 36-hour shift that never just seems to end. We ask for a minimum wage and they give us hero speeches while our colleagues collapse and die in the call rooms from the very exhaustion that we are supposed to treat. Make it make sense. You know what? Don't. Just say, I'm tired of trying to make sense of what doesn't make sense. Make sense? No. So you look for the exit. You look at the map and think, there must be somewhere else where my hands would actually matter. You study for the PLAB, the USMLE, you drain your life savings just for a chance to breathe. But the world has grown cold on us too. You reach there and they close the gates on your face, saying we're prioritizing our own now. So a surgeon from Lagos becomes a healthcare assistant in a grey city overseas, wiping spills and cleaning linens just to put the lights on. From saving lives to just surviving. What is a healer who has nowhere else to heal? I look at the mirror and I don't see a doctor. I see a man who is tired of being the only thing standing between a broken system and a shallow grave. I'm tired of the well done doc that always rings like a funeral bell. I used to have this fire in me, but now it's just ash. I saved 3 babies last night and I couldn't stop but think, I am so sorry. So sorry that this is the world you had to wake up into. As for me, I am still here, but the doctor in me has died a long time ago.
Let's not pretend anymore. Nigerian doctors today, or practicing medicine today, is highly exhausting. Imagine, you heard from him. He said the life of a being in Nigeria is less than $5. That is pathetic. That is pathetic. That from his experience. So being a doctor in Nigeria, you work long hours. The equipment is outdated and or non-available. The infrastructure is collapsing and collapsing fast. And patients are many, but resources are few. And you have so much workload because the doctor to patient ratio is increasing at a very fast rate. In that same Twitter page of this medical doctor, I read a story of a person who took his wife to a private hospital for child delivery, and to cut the long story short, the child was saved but the wife was lost. And he said even the ambulance in the hospital was covered with tarpaulin, and the bed, trolley bed to carry the wife when there was emergency did not have a guard to protect the wife on both sides, and there was no belt to strap the lady, and it was on the third floor. So they were not debating whether to take her through the staircase, can you imagine, or through the elevator. And in the process, the wife, who was already bleeding internally, who was to be transferred to a government more specialized hospital, fell down from the trolley. Don't let me continue with this story. It's very pathetic, very heartbreaking. Very heartbreaking. That is what's happening in Nigeria. Ordinary trolley bed. Even the ambulance was not in top condition, and the whole management system was terrible. Well, doctors are working dangerously long hours in Nigeria, covering multiple roles at once, carrying responsibilities without adequate support. Then there are so many parts which they cannot even talk about because the trauma they experience, like that one of the doctor that shared this experience, the trauma they experience lives long in them, even beyond that of the family of the patients when the unpleasant happens. Because with all the skills they have learned, they know what they could do, but the resources are there to carry out the things to save that life. So that predicament, that dilemma, is not something you can imagine. It's beyond your imagination. So that is why they have to make a choice now. Is it to wait or to leave, like that doctor was saying in his presentation? Either to leave and look for a place where you can operate with a good conscience and with a good heart, with limited trauma. You know what to do, and you have resources to carry out what you ought to do, what you have to do to save that life that was brought to you. So the migration reality is there. So many of them end up going to the UK, to the United States, to Canada, and to Australia. Those are 4 major places where they are given the opportunities and the resources to carry out their profession, their desire, their destiny of saving lives. Though they have to go through many exams like the PLAB, USMLE, MCCQE, and thousands of Nigerian doctors are quietly planning to achieve this. But here is the truth. Living is not easy. It takes a lot of planning, a lot of preparation, a lot of fun, and a lot of emotional strain. Because the train here in Nigeria, their desire is to help lives in Nigeria. But now, the system is chasing them out, is choking them, is putting them under avoidable pressure. Many are collapsing and dying when they could live and survive and help others to live and survive creditably. So the system problem is this. The system, yes, have the policies, the plans to improve the facilities are made. How many times do we hear in Nigeria that the resident doctors are on strike, this one are on strike, this one are on strike, because they keep talking about these things? But those in authority, they are callous about it all. But that's why this video is coming out. It's a clarion call. Please rise and do something about this. Nigeria is bleeding. The doctors to help in the healing, they are bleeding. Then what do we have for the nation? But the nation will survive it. So the danger cycle is this. The doctors leave, the workload increases because the doctors available are not enough to take care of the patients. You know, because of the pressure in the system, more and more people are collapsed because stress reduces your internal system immunity, and this one predisposes people to various forms of illnesses. So when the pressure in the system becomes so high, that means more and more people are likely to get sick, become pushed down with small infection and not able to push them because their immunity level is low. So more doctors leave, some burn out. But the advice for the doctors is this: your life and your living is important. Survival. So let's get practical about this. First, doctors, if you're a medical doctor, a medical personnel, protect your mental health. Avoid burnout, because burnout is real. Ignoring the signs is very dangerous. You can find palpitation in your brain. You can feel some nerves twitching in your head. You can feel your nerves stitching in your hand. Your tongue and is sticking to the roof of your mouth. Your mouth is getting dried up, and you find some of your limbs shaking unnecessarily, or your eyes are leering. You can hardly coordinate again. Then it's time to say, no matter what, your life is important. Your family needs you. The nation still, the other people in the world needs you, even if the system is behaving otherwise. So protect yourself, protect your mental health, like I said, and build a dual track life. Don't depend just on that system. Try to find a way to relieve your system and to improve your income. If you can develop a side income, and long-term plan is also very important. So be strategic about your life, about your family, not emotional. So whether you stay or leave, let it be a decision, not a reaction. When you leave, you are not running out. You are just looking for a better pasture where you can plan and act and practice your profession to the best of humanity. Nigerian doctors are globally respected. So equip yourself very well. Don't be a broken machine. Don't be a broken being. Be a living being. Protect yourself. So thank you so much for listening to me. If it resonates with you, please share it, give thumbs up, and subscribe to my channel. The medical doctors need help. The medical doctors and the health system in Nigeria needs urgent attention. Don't push them away. Don't push them away. There was a time when a foreign country was planning a mass recruitment of Nigerian doctors in Abuja. They sent their They said their personnel to be recruited medical doctors, and they were going in tanks. The federal minister of health, the federal minister had to shout and had to block it. Say no, no, they should stop it. Why? You don't value them. You don't value them. You are killing them. And in our culture, Yoruba land, southwest Nigeria, the adage is that wọ́n ní abẹ́ ọmọ kì í gbọ́ igbe ọmọ ẹ̀ kó má tagìrì. That is a real mother, a real parent cannot hear the cry of the child and remain indolent and remain quiet and remain unbothered. It's not done according to our culture. But these children of the land, they are crying, they are saying these things. That's why you go back and listen to that tape of the medical, that's Dr. Usman on Twitter. He had been there for the past 2 years, and he now came and said the doctor in him, is he say he's dead or he's dying? Can you imagine his frustration? And that's not only of his own, that of his colleagues also. Let's do something. Thank you. God bless you.